how much privacy is appropriate in hospitals? Over the last 100 years, the architecture of emergency rooms and medical wards has changed to make care more private. Originally, 100% of hospital beds were laid out in large wards where patients lay side by side. But by 1910, that number had dwindled to 28%. As the care of the wealthy migrated from their homes to private rooms in hospitals, the large communal wards began to disappear. Then that's one thing that I had to reckon with, that even though I loved medicine, I started to love medicine again at the public hospital because of the equity that we provided patients, because it was about medicine and not transactions. It looked different than the other places. It looked different than the hospitals I'd visited with my father. These were wards. These were wards where, like, you would talk with a patient, you would have to squeeze in between rails in order to get histories. And so, and the thought was amongst peers, people, is that that's not really good medicine, right? How can that be good medicine if people are so crowded together like that, if there's not privacy? And that's something that I had to reckon with. But I do think that there are certain things that we have forgotten in going back to the first graph. We have a very expensive healthcare system that's really based on privacy. It's really like one of those things is like trying to provide more and more privacy at increased costs. But one of the things that I found also in working at a public system is that there are some benefits from less privacy. There's a balance to be struck, of course, but there are some benefits, and there are some things that we can glean from those from that.